One other area I just wanted to touch on, which is, I don't know if anybody's heard or been diagnosed with, is this condition called polycystic ovaries. A lot of people who go for scans have a diagnosis of polycystic ovaries, which all it means is cysts in the ovary. And if you Google polycystic ovaries, it will come up with a condition called polycystic ovarian syndrome. And polycystic ovarian syndrome is a condition where people are often overweight, have spots, excessive hair growth, and no period. But also, if an athlete is scanned, they have a different picture. They have exactly the same on their ovaries. It looks polycystic, lots of little, poly meaning lots of little cysts in their ovaries. But it's not anything to do with polycystic ovarian syndrome. And what I'm saying is if you have a scan and you've been told you've got polycystic ovaries, it is more than likely nothing to do with polycystic ovarian syndrome. Polycystic ovarian syndrome is due to an upset, and I don't know what Kevin's going to mention, in your insulin. Nothing to do with your upset with your insulin, and it makes you put on weight easily, have excessive hair growth and spots. And in polycystic ovarian syndrome, you have high levels of estrogen, and therefore you don't have the problems of osteoporosis, you don't have the problems of stress fractures. But in multicystic ovaries, where you have the same cyst, but it's due to being an athlete, you have low amount of estrogens, and it's all primarily due to the leptin in the body fat. So take-home message there is if you ever have a scan and you've been diagnosed with polycystic ovaries, ring me up because you probably haven't got polycystic ovaries. You've got a different condition, but it's just the scan that shows it. The other area which I think is, I've just got briefly mentioned, is stress, and has that an effect on your hormones? And there's huge debate about this. But I think in my mind there is no doubt that stress has the potential to have a negative effect on hormones. And 3 studies I can give you that. It's an awful study, I don't know how it was done, but it was done in America. Just before execution, women always have a period. How they found that out. And men stop producing sperm. So the stress of that can have a negative effect. 2, I've got lots of personal experience with athletes who, when we take out their stress, their periods come back. And 3, the one area, because we can learn a lot from animal husbandry, and there's lots and lots of evidence in the animal world. And one study that I was involved with once with a stud, horses, we had a big barn where we had 12 horses down that side and 12 horses that side, all mares trying to get pregnant. And their pregnancy rate was very good. And then suddenly their pregnancy rate would drop. Their pregnancy rate used to be about 90%, and then it dropped to about 50%. And we couldn't work out why. And then we worked out why. When the barn was full, the pregnancy rate was good. And the majority of the time, the barn was full. But when the barn became half full, the pregnancy rate went down. Why did it go down? Because the horses got upset because of the echo. And the echo was different, and it upset them. And they stopped ovulating. We then put some other horses in to make the echo better, and the pregnancy rate went right up. So we've got lots of work to show that stress, I think some people, stress has no effect, and stress may be positive, but there's definitely some people that stress can have a huge effect on your menstruation. And I don't know if it happened to any of you here, but you know, how a lot of it we don't understand. People who live in the same flat, often, if they're not on the pill or anything, often will have periods on the same day, at the same time of the month. And definitely I've heard it in rowing, 8s, they'll often ovulate at the same time and menstruate at the same time. So there's lots more than just all this with regards to hormones. So stress can have a significant effect on hormones in many ways. And it may be that it's stress and upsetting the hypothalamic pituitary gonadal axis, etc. The one other area that people often talk to me about is fertility. And all this probably does not have an effect on fertility. But there is a problem. There is a new test, and that's what I'm telling you, that if you ask about it, there is a new test called anti-Müllerian hormone, which is a hormone that you can test people for, and it looks at your fertility. And it tells you how many eggs are in your ovary. And if your anti-Müllerian hormone is low, it indicates your fertility is going to be reduced. Anti-Müllerian hormone comes from when you're producing an egg, in your ovaries, the eggs are sitting there. And it's like your eggs being in the fridge, okay? And each month, the eggs come out, and one comes out and is used. And what anti-Müllerian hormone is measuring the eggs in the fridge. I have found and researched, and we just published this, in athletes, if you measure anti-Müllerian hormone, it can be low. And instantly one is saying one's fertility is low. That is probably rubbish. What is probably happening is your eggs move from the fridge into the freezer, and they don't produce this hormone. So they are still there, lots of them there, but it may, to the outsider, appear that your fertility is upset. But the evidence for that is definitely not true. But if you do go to a doctor and you say, can I have my fertility tested, and they test it and it's low, question it, or again, if you want to talk to me. Any questions so far? No. If we just move on then, because there's sort of three briefs that Rob gave me, is one, just talk about the menstrual cycle and give you a bit of background, 2, premenstrual syndrome, and 3, contraception. So I'm just going to go through those a little bit more and talk about how, more practical thing on how one can delay the period. So, and I think here, I'm just going through this is sort of basic stuff, but it's just useful. What is the norm? The average age of the period is 28 days, but the norm ranges between 24 and 35. So if you're shorter than 24, if you're greater than 35, but I think also it's change that is important. So if you identify change in your periods, you start bleeding too early or too late, begin to talk to people about it. We've already talked about the average age of the first period, about 13, getting lower. The average age of the menopause has stayed the same through history. Age of the menopause is 51.2 years. The average age of the first period has moved. Turn of last century was about 17, and now it's about 13 years, well, 12 and a half to 13, probably because of increased diet and better diet, etc. So that's changed. The other thing that really affects the menopause, brings the menopause on early, is smoking. So we've just briefly talked about, we've already seen where this is another graph of the same thing showing what happens to your hormones. How much people bleed for does vary, but it's normally the amount of volume of blood is about 60 mLs, about 12 tablespoons. That's the average amount of blood. But everybody can be different, and in one of the research studies I did, we used to actually measure blood loss. And I remember one woman who came in saying she had heavy periods. She was actually only losing about 10 mLs a month. But to her, they were heavy because she used to lose 5 mLs a month. So there was a change. And another woman who said my period's absolutely fine was losing a litre of blood a month. So it depends what you are used to. And the average amount of bleeding lasts about 5 days. What are the problems one can get? One can get heavy periods, which is called menorrhagia, and that can be due to many causes. So if you start getting heavy periods, one can think of, it can be due to a condition called fibroids or polyps in the uterus. You can get painful periods, and one of the conditions which I think is important to think about is endometriosis. Now, endometriosis is where the lining of the womb lies outside the womb, and it can cause painful periods and pain with intercourse. And it's a very common condition, and it's very, very, very underdiagnosed. And a good scan can help diagnose that. Irregular periods, when you get infrequent periods, can be associated with upsetting your hormones, and that's beginning to be the signs that you can get when you're running into problems with your menstruation. And when they stop, they're called lack of periods. So heavy periods, it's really if there is a change. And if there is a change, do speak to Rob or your GP, because it can be a problem, not only that we may be identifying a problem like a polyp or fibroid, but it also can affect your performance, because if you're suddenly losing twice the amount of blood, you're going to become more, because blood's full of iron, you're going to become more anemic, and it can have a negative effect on your performance. And that's why it may be, if you're having your blood test for your iron, tell the doctors when you're having your blood test, where you are in your menstruation, because it can be a difference If you have it just after your periods, it's going to be different to having it just before your periods. What tests do we do for heavy periods? Mainly it's a scan, a good scan now. An internal scan can be very beneficial to help diagnose what's going on.
I was asked a question. It's a bit medical. Do you ever prescribe tranexamic acid for
Yeah, yeah, it's a great drug. Great drug. I think it'll be one of my first line. I noticed you had some.
Yes.
There's an Indian version called Quas Bandish Kum, which means bleeding I stop. And tranexamic acid now, you may know more about it than I do, that it's being used in trauma surgery. That they're putting a drip up of tranexamic acid if you break your leg, or if you're bleeding a lot. So I think the BNF says 1 gram 3 times a day, do 1 gram 4 times a day for 5 days. Always advise the person to have it's a 500 milligram tablet, have 2 tablets in your bag and start it the minute you start bleeding. 1 gram 4 times a day for 5 days, or if your bleeding stops after 4 days. And there's no reason why. They always say if you had a blood clot, but there's no reason. I mean, because in the end of the day, heavy periods is a subjective thing. Yeah, I mean, if you look at the research, which there isn't so much being done now, all the research was done with people over 80 mLs. So people below 80 mLs were counted as normal. But there's no reason, because it's an antifibrinogen. So there's no, it's good for nosebleeds. So if it's going to stop a nosebleed, it's going to stop bleeding, it's going to help you whatever. So I can't see any reason why that couldn't be used for people with heavy periods and low iron. Yeah, no problems. Pain with your periods. Again, I think it is important. The trouble is, I suppose, being a gynecologist, I see, if I was a GP, I'd probably say everybody's got pain with periods. I see the worst end of it. But again, it's change. If you have any change, do talk to somebody about it. It may be nothing, but you may pick up something. Painful periods, I think, does need investigating if they're coming to see me, looking for this endometriosis. Endometriosis is where the lining of the womb, so go back to my grass story, the lining of the womb lies outside the womb. So endometriosis is like grass, which should be growing on your lawn, is growing on your path. And if I go back to one of the patients I had, but I did treat, she had endometriosis in her nose. And so every month she had a nosebleed. How did that happen? Don't look so shocked. How did that happen? Probably she had a little cut in her nose. She changed her tampon and she sneezed and she got a little bit, because the bleeding is not just blood, it's the lining of your womb coming out. She changed her tampon and she got a little bit and she rubbed her nose, and that then embedded into her nose. So every month she had a nosebleed. Now endometriosis, am I going too far? Is that going too much? All right. Would you boys like to leave now? You wait, it's going to get worse. Men can get it. It has been reported in men. Now you've got, but if you can imagine then, you see, when you have a period, the blood comes out this way, but also it can come inside there. Shall I move on? Right, okay. Painful periods. If you want to talk about endometriosis, do give me a shout afterwards. Irregular periods, probably due to not ovulation. So back to my story. If you have normal menstruation, you ovulate is ovulation, and you cut your grass every month. If you're not ovulating, grass gets torn, and you can get irregular bleeding. Again, talk to somebody about it. And finally, when do you get delay in your periods? If you don't have a period, most common cause is pregnancy. So always think of that. But stress can cause it. This is no periods, polycystic ovaries, weight loss, etc. But again, if you've missed it, the odd miss is fine. But if you do miss it on a regular basis, then I think it is important to seek help.